As health officials across the U.S. monitor the spread of the new Omicron variant, COVID cases continue to rise nationally, averaging more than 100,000 new cases a day for the first time in 2 months, and new rules for international travel went into place today as well. Anyone flying over the age of 2 will now be required to show a negative COVID test no more than 24 hours before boarding their flight into the U.S., or they need to show documentation that they have recovered from COVID-19 in the past 90 days. Infectious disease specialist at South Shore Health and ABC News contributor Dr. Simone Wildes joining us now. Doctor, good to see you. So are these new requirements by the CDC the right prescription to deal with the spread of the Omicron variant in the U.S.? What are your thoughts?
I absolutely think they are the right requirements at this time. You know, we're in the midst of a pandemic, and now we're dealing with the Omicron variant. I think the CDC has really been setting the stage for us to make sure that we're all safe and we're all healthy and well. I think this is the right move to make as we try to sort out what's going on with the Omicron variant. So I would encourage everyone to make sure they adhere to these recommendations.
And doctor, the Omicron variant in South Africa was detected in late November. It already accounts for 75% of the cases in that country. So it does sound like it is a rapid-fire transmissibility here. Why are scientists in the international community, what are they going to do about that? Still early, what do we know so far?
Well, you know, I must say there seems to be a lot more unknowns than knowns. You know, we're still trying to figure out whether, you know, it's going to affect our vaccines, how it's going to affect testing, the medication, the transmissibility. We do know, though, that it has a lot of mutations, and that has all of us interested in what this impact is going to have on the spread of the disease. So big thing is we know about lots of mutations. We know it's spreading faster than the original virus. But I will say there's absolutely more to come, and we will share this information as soon as we have it.
Well, as you know, many Americans have not only received their first and second dose of the COVID vaccine already, but also a third booster shot, and that was recommended by health officials in the U.S. So do you think these vaccines will be effective in controlling this new variant?
Well, right now, the early indicators suggest that the vaccines work and the boosters work. So again, I would use this opportunity to encourage everyone who did not get their vaccines yet to still go ahead and get the vaccines. And of course, if you're eligible for the booster, get the booster. They're studying it right now, the impact of Omicron on vaccines. But there's no reason for you not to get your vaccines or boosters at this time.
All right, Dr. Wildes, thanks very much for that as we continue to track this Omicron variant.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.